Hi, this is Dr. Leo Powers, and I'm going to go over the condition fibromyalgia. Fibromyalgia is a condition where you have aches and pains all over the body, and before they diagnosed this with fibromyalgia, use that term for it. They used to call it rheumatism. But basically what it is you got aches and pains in several different spots on the body. And in SOT Chiropractic, they divide the stress into category 1, 2, and 3. And category 2 has the symptom complex of fibromyalgia. But first, to understand what category 1, 2, and 3 is, category 1 is a respiratory fault in the pelvis and in the head. And then that causes problems with your metabolism and sleep. Category 3 is more the intervertebral disc. That's the cushion that goes between your spine, and it's usually down in the lower back, L4, L5. And that's not fibromyalgia. So a lot of times people have x-rays, they have blood tests to make sure that you don't have some more serious problem. And so once you've gone through this diagnostic process, they diagnose you with fibromyalgia. Then basically it's category 2 symptoms, because category 2 symptoms are pain down the side of the leg, front of the leg into the groin, medial knee and ankle and foot, and then also shoulder and arm symptoms, pain up in here, lateral side neck pain, lateral side headaches. It also causes headaches, and these are very uncomfortable. They're very real pain syndromes, but it's because the joints haven't deteriorated and because the disc isn't deteriorated, they lump it together in a symptom of a fibrous tissue that's irritated. So the correction of it is relatively straightforward with SOT chiropractic treatment, and it ties in with the category 2, and category 2 has to do with the sacroiliac. And the sacroiliac is the pelvis part. That's that lower part where your buttock is, and there's 3 bones down in there. There's the ilium on either side and the triangular shaped sacrum in the middle. And what happens, the connection between this one and this one is loose, and so when it separates, this will rock back, and when it rocks back it causes a short leg on that side, and then it causes symptoms in your knee and your ankle and foot, and also causes symptoms up in the shoulder, because when this is shorter, then your spine has to shift up in here, and then your head has to shift too. And it's all related to a ligament weakness in the SI, and it can be on both sides, because sometimes people have it all over, not only on one side mainly. So it's still very uncomfortable and it hurts, and it's often brought on by some type of trauma in the past, that you may have had a fall or an accident that wasn't treated properly at that time, and then it has precipitated the short leg aggravating when you're walking, etc. And so the treatment is actually very simple, straightforward, very gentle with the SOT chiropractic. And what we do is we put people on wedges, and then as they breathe, the bones move back into place. And then we give you some exercises to do. And then also there's ligaments that sometimes up in the shoulder are loose up through here, and we use either a galvanic treatment or a Kineso tape. And the Kineso tape was developed in 1994 by Dr. Kineso in Japan, and so we put the tape on to help to the bones to be tight together, and as long as the tape is on, your bones will be tight together, and then they heal back together. So it's like a bad sprain in your pelvis, in your shoulders, and then also some of the connections between the muscle and the bone. Some of those are a little loose, so we treat those. And then the lower leg actually has a normal range of motion, and it's easy to tell if you have stress in the lower leg just by checking to see how much motion you have in your ankle. And this is the ankle bone, this is the talus, and this is the tibia and fibula. And what often happens in people that have fibromyalgia is these ligaments are a little bit loose, And so it's normal for this to move out 20 degrees in the eversion and in 30 degrees. And if this slides down, if this is weak in here, then you can't move that out as good. And so then instead of 20 degrees, you'll have maybe 0 degrees motion. And so the correction is you bring this in, I put some Kineso tape on here, and then I do some foot adjustments on the foot bones. And then there's a cranial treatment that you treat the head to give it endurance for your feet and your ankle and then your hands. And it has worked very good. The other thing you need to do is to work with categories 2 symptoms, ties in with the diet some, where you want to restrict your refined carbs and eat more real food, whole food, like God made it. You know, vegetables and fruits, whole grains, meats, dairy products, healthy things like that. And then the body will start to heal. And so it's more involved in that. There's more techniques within it, but then SOT treatment, it's more of a whole body approach where you treat the cause of the symptoms, and then your body can heal and can get stronger and better. So most of the time, fibromyalgia can respond within about 6 to 8 weeks of treatment, but each case is unique, so you would have to have an examination to know more exactly how many visits it may take to correct this problem. But most people have already had lots of diagnoses, lots of blood tests, lots of x-rays, so they've already ruled out some of the other problems. So it's actually, most of the time, it's a category 2 treatment. Please, if you have further questions, give us a call at 715-341-7102 or call to schedule an appointment. Thank you. This is Dr. Leo Powers in Plover, Wisconsin.